So social prescribing is obviously one of the buzzwords at the moment. There's a lot of projects going on. Statistics show that 82% of the population look at the internet every day. So there's a massive scope. If you look around you, everyone's engrossed in their phones and in technology. And if we can harness that to signpost people towards different healthcare resources, I think that could be very powerful.
Social interventions for health have been around for years, and it's really exciting that we're now starting to give them the weight that they deserve within the medical model with social prescribing. I think digital technology can play a big role in supporting access to different interventions, whether that's community-based theatre, whether that's community groups, whether that's coding classes. It's starting to allow us to think about the wide range of things that people do in their lives and in their community and how that can improve their health and well-being. So I think the role technology can play is for access and support for people who are physically isolated as well and socially isolated. They can actually partake in different social activities online or in the future through virtual reality.
A lot of the workload coming into primary care in particular is patients ringing up for various different things, not all of which need to see a GP. So I am a GP, that's why I keep coming back to primary care, but a lot of resources are used up, and if we can come up with a signposting app or pathways that can be accessed online without needing to see a doctor, that can be really valuable.
What's great is that GPs also are going to be able to have access to a wider range of support and interventions that they can suggest for their patients. Often there's so many things that are happening in the community, within organisations, that there's not that information in a centralised location. And what social prescribing will allow GPs or primary care health practitioners or community nurses or schools to be able to do is find out what's happening locally for them and be able to refer young people, adults, parents to those interventions.
I think there's also some scope for sort of video consultations. I know this is quite a topical thing, particularly with Babylon and other organisations. That's more for sort of a doctor point of view. But if we can have remote smoking cessation clinics or remote counselling for obesity, maybe as video calls or group video chats, that could be really beneficial, particularly for people who are housebound or can't get out. There's a lot of barriers to access, and technology may help us be able to sort of avoid those kind of things. I think also social prescribing is particularly relevant. People are often accessing Facebook, Instagram, all of these things. There's a lot of online communities, particularly there's one called Mountains for the Mind, which is a particularly good one that I've come across. It's people who all like hiking, and then it's much easier for people to initially interact online, particularly if you've maybe got depression or anxiety, and then people can form groups together and then develop more face-to-face interactions. But sometimes the technology can enable those sort of first steps